lot of different types of shoulder injuries here at Caring Medical in Oak Park, Illinois, and it's actually something that I've taken a special interest in my practice. So I wanted to take the time to talk about a few of the most common shoulder injuries that we see, and I'm going to start with the AC sprain. So the AC sprain is just that. It's a sprain of the acromioclavicular joint in the shoulder. And what that is it's the joint between the clavicle and the acromion, or more commonly between our shoulder blade and our collarbone. So those are two of the bones that help make up the shoulder joint. When people come in with an AC sprain or even a dislocation, most of the time they've either fallen onto their outstretched hand, as a way to catch themselves, or they've had some kind of direct blow to the shoulder, whether it's from a football tackle or in hockey getting pushed up against the boards. That's usually the most common way that they injure it. And they're actually graded. So some people might have just kind of a mild sprain, stretching of the ligament, and some people can actually completely tear it and separate the two bones altogether. Regardless, no matter, kind of all along that spectrum, people that have an AC injury or an AC sprain get a lot of popping, a lot of cracking in that joint. They have a lot of pain when they're moving their shoulder, especially with overhead activities, like if they were gonna, reach for something on the top cabinet, brush their hair, or pain even when they're reaching across their chest, which is pretty common, with like a backhand in tennis or a golf swing. That's usually where they get the bulk of their pain. In more severe cases, they might even have pain at rest or while they're sleeping. But like I said, that's usually more severe, not a lot of what we see here. What happens with those injuries, whether you fall on your outstretched hand or you get a direct blow, is you injure that ligament, the AC ligament that holds those bones together. And you stretch it out a little bit, you might even tear some of the fibers, and that really causes a lot of pain in and of itself. 6 weeks, 8 weeks, months down the line, why we see patients that still have pain in that area is because the ligament hasn't fully healed. Ligaments by nature don't have a great blood supply. They're not like muscles. Muscles are red, have a great blood supply, heal really well. Ligaments not so much. So if they're not healing properly or they don't heal at all, people end up with a lot of chronic pain and even lose range of motion in their shoulder because they're not moving it because it's painful and so forth. Here at Caring Medical, I treat those injuries with Prolotherapy. Prolotherapy is an injection technique that is used to strengthen injured ligaments. So if someone has, even if it's their AC joint or other other ligaments of the shoulder or any other body part, we use Prolotherapy to strengthen those ligaments to better help hold that joint in place and decrease the acceleration of arthritis. So if someone comes here, they have this kind of injury, they might even have x-rays or other imaging with that diagnosis, even though it is not necessary, we would treat the whole shoulder. We do that because when someone falls on their outstretched hand, gets a direct blow and an injury, chances are they didn't actually only strain their AC ligament. They probably strained a lot of other tendons and ligaments around the joint. So we treat all of them to help make the joint more stable, better hold those bones in place, and decrease the wear and tear on the cartilage that lines those bones. On average, for a shoulder, we see patients for about 4 treatments, although it can range, anywhere from 3 to 10, depending on the severity of their condition. And we like to see them every 4 to 6 weeks to optimize healing.